specialists within mental health services, it's around thinking about what is their specialism in. So generally, a mental health service will be specialist around mental health, but we would want them to then adapt anything for any individual that came to that service. So notwithstanding whether you had autism or a learning disability or
trauma history,
we would expect somebody who's working within that specialism to adapt that service to whatever kind of presented itself to the service. So one of the things is actually trying to think about things more inclusively and to say, well, actually, yes, we want to make sure that our mental health services can look after people with autism and learning disabilities, but we don't know at what point in the process they would be. So, for example, if you had somebody who wasn't formally diagnosed with autism but had some of those traits, we would still want the service to be able to work with them appropriately. So,
I mean, the other thing I would say, I've been around a really long time, and I remember the arguments around learning disability. We had to fight really, really hard to make sure that if you had a learning disability and your primary need at that time was mental ill health and you needed some treatment for that you wouldn't be denied access to the mental health treatment you required and the specialism that was required around treatment of depression or schizophrenia or so. And that argument was had a really long time ago. And we had to admit, we had to recognise that for some people, mainstream mental health environment wasn't correct, but we had to collaborate and look at different environments for that. People in mental health services have been treating people with autism. The only thing that's changed is our diagnostic effectiveness. So what's happening is that probably the same people have been in mental health services, and we know that because often they're getting their diagnosis midway through mental health treatment. So the only difference is that we now know they've got autism. So that allows us to make our mental health treatment better, but it wasn't that there's a whole new cohort of people. It's just that we're being more effective diagnosing, and I think that gets misunderstood. Some of the commissioning we've done around that and some of the plans that we're doing around that for building the right support is very much about colleagues in other areas where there is more specialism around what we call formulation, which is basically just working out which bit's most relevant at the time to the distress that somebody's experiencing. So where perhaps in learning disability we've got psychology colleagues who can perhaps help with that sometimes. Likewise in mental health we've got psychology sitting in parts of the service. So we are looking at how we can all help each other to work in a liaison role, not end up with kind of a tiny team of or a team of specialists that take all that work on board, but to share that skill across.